Hey y'all, it's Dr. Ruth Doughton here with your daily mental health tip. Today's tip is to take a more active role in your mental health treatment. Now, what do I mean by this? Well, if you're one of the lucky few who's taken one psychiatric medication and your symptoms have gone away and you're not having any side effects, that's amazing, and maybe you don't need to make any changes. But if you're like the many people who tried multiple different psychiatric medications and either your symptoms are not in remission, or maybe the medication worked for a little while and the effect seems to have worn off, or maybe the side effects have you wondering if it's even worth it to take the medication, then maybe it's time to do something different. Now, don't get me wrong, let me be very clear. If you're at all considering making changes to your medications, this is something that you need to do with your mental health provider, as it can be potentially very dangerous to do this on your own. So I'm not suggesting that you stop your psychiatric medications. What I am suggesting is that you do your research, look into what are root causes of mental illness. On this channel, we talk a lot about metabolic causes of mental illness, but there certainly are other causes as well. And looking into what are things that I can do to make a difference aside from and in addition to psychiatric medication that could bring healing. So I'm talking about things like changes to your diet, to sleep, to exercise, to your social connections, to the substances that you're consuming, the hormonal imbalances, and other things. If you have questions or concerns, please bring them up to your psychiatric providers. If something's not working for you, let them know. If you've read a book or an article or heard a podcast and you learned about something that you think is interesting that maybe you want to integrate into your treatment plan, bring it to your appointment and talk about it with your prescriber. A good prescriber is going to want to work with you on achieving your goals and will be interested in not only helping you, but also learning from you. Wishing you all good mental health today, and I'll see you in the next one.